With those 3 quick steps, a tobacco smoker will inhale more than 7,000 different chemicals and compounds. There are hundreds of toxins in a cigarette, and at least 69 of them are known to cause cancer. Some smokers aren't bothered by these facts and will smoke anyway. WVU junior Christina Akers isn't worried about what the effects of smoking will do to her, only just the smell.
Besides they stink, no.
As a tobacco treatment specialist for WVU Health Sciences, Catherine Whitworth tries to spread the word about what is really in a cigarette and why.
There is everything from formaldehyde, acetate, nail polish remover, ammonia, and strychnine. I mean, there are horrible chemicals. Some of these happen as a result of combustion, but a lot of them are added by the cigarette manufacturers to make the product be absorbed into the lungs more quickly. But really nothing in there that is providing a benefit.
But just because you aren't the one inhaling the cigarette does not mean you cannot be harmed.
All the harm that's done to a smoker who's smoking can also impact non-smokers if they are exposed to tobacco smoke.
Tobacco smoke damages every organ of a person's body, along with their bones, joints, and skin. A person does not have to be a heavy or a long-time smoker to get health problems. Even a little bit of smoke can have an impact on someone's health.
Most people, when they think about smoking and the things that can happen to you because of it, they're thinking about cancer, 40 years down the road. And it's true. I mean, smoking causes just about every kind of cancer that you can imagine. It does cause lung cancer. 85% of lung cancers are due to tobacco smoke. But it also causes cervical cancer, kidney, uterine, bladder, leukemia, breast cancer, even in young women. And in older women, particularly if they were exposed when they were younger and the breast tissues were still forming, and during those years before you have children. And so it really puts our young women in harm's way.
For WVU senior Allison Kupak, cancer is the main reason why she stays tobacco-free.
I don't smoke cigarettes because all different types of cancer run in my family. A family member of mine actually had lung cancer from smoking. I just think it's an unhealthy habit, and my parents used to do it when they were younger and kind of just advised me my whole life not to do it. I don't know, I just think overall, to be healthy, it's just not a good choice.
Cancer has been linked to around 443,000 deaths each year, with 49,000 of them due to secondhand smoke. But surprisingly, more people die from the cardiovascular effects that tobacco causes. Coronary heart disease and stroke are the main types caused by smoking. They are the first and third leading causes of death in the United States. More than 2,600 Americans die every day because of cardiovascular diseases, which equals out to about 1 death every 33 seconds. Sadly, there are other many health issues tobacco smoke can cause.
Tobacco smoke can actually damage your DNA. And even in men who smoke, it can damage the DNA that's carried in their sperm, and that can be passed on and cause poor birth outcomes. And smoking and exposure to tobacco smoke really weakens your immune system. And so people who smoke or inhale a lot of tobacco smoke, they're just going to get sick more often because your immune system is constantly fighting the damage that's always done to it.
Luckily, there are many programs that can help someone to quit smoking. The West Virginia Tobacco Quit Line is a free state-based program that places a coach to each person in order for them to get ready for their quit day. The Quit Line also provides free nicotine patches, gum, and lozenges. They also suggest that people think about what they do while smoking, such as driving, drinking coffee, or drinking alcohol.
I smoke cigarettes when I drink just because it gives me something to do.
People who are trying to quit really need to look at their habits, and maybe practice. Before quit day comes, pick one thing that you usually do along with smoking and do that thing without smoking, and then they'll realize that those cravings come, but then they go.
For more free programs and information on how to quit smoking, you can call 1-800-QUIT-NOW or log on to freedomfromsmokingonline.com. Reporting for WVU News, I'm Katie Ann Marshall.